Afternoon, guys. How are you? David Johnson here from Functional Movement Training Centre, City to Coast Neurosurgery and the Back Pain Centre. It's Friday afternoon again, and we are post-op. Looking forward to a great weekend. But before I pack up for the day, I thought I would just do a quick video for you about pain. And why are we talking about pain? Pain is the most common reason. It's almost probably 99% of the reason why people come to our centre to see me, because they are feeling unrelenting, persistent pain. You've got to remember, a lot of people will have had pain for short periods and the pain settles down, and we know that people with back pain, the vast majority of people will experience back pain symptoms that settle down spontaneously, regardless of what you do. But a very important concept is that the most likely reason that someone develops chronic back pain is because of poorly managed acute back pain. So those short little episodes of niggly pains that you get that settle down after a bit of Nurofen and after a bit of rest, maybe a day off work, and then it all comes good again. That is the time to become educated about your back pain, to see a specialist who understands back pain intimately, and learn what the actual root cause of your little flare-ups of back pain are, so that those little flare-ups that relapse and remit, so that those flare-ups don't then become persistent pain, because chronic pain is a whole nother beast that has associated with it many other health complications. Now, we know from research and data, World Health Organization, WHO, has just come out with a statement in February that low back pain is the leading cause of a disability. Okay? It's the leading cause of disability. Low back pain is number one in terms of making people suffer. And we have to accept that most people who have low back pain, chronic low back pain, the massive majority of people who have had low back pain have not had surgery. Okay? Most of them have not had surgery. And therefore, we have to accept that if we've had rehab, a lot of rehab, it doesn't matter what you choose to have in your rehab, whether it's physio, whether it's exercise, whether it's Pilates, okay, whether it's massage, deep tissue release, okay. And most patients that I see who have chronic low back pain have tried all of these things. And if they are still continuing to suffer low back pain after years of rehabilitation, we really do have to accept that there is a condition that's called failed rehab syndrome. Failed rehab syndrome. Okay. What's the significance of this? Well, if back pain is the leading cause of disability worldwide, it really does call into question what the heck are we doing with our conventional rehabilitation. All right? If we have so much back pain in the world, and these patients are not recovering from their chronic back pain with the rehab that is being implemented, listing off all of those things there that people do, and it is a $100 billion industry, the back pain therapeutic industry. we have to accept that we have a condition called failed rehab syndrome. And so the paradigm shift that's required is to understand that the cause of back pain, needs to be defined. Okay, we've got to define the cause if we're going to get effective rehabilitation. Without a definition of the cause, all of those things are highly likely to fail and account for the failed rehabilitation syndrome and account for the very high prevalence of disability from low back pain, number one. And as yet, there are really very poor guidelines, very poor descriptions of the cause of low back pain. And in fact, the peer-reviewed literature just says it's nebulous, okay? Or we say it's non-specific. And they're very openly saying we don't know. And therefore, that really sets an extremely low bar in terms of rehabilitating people from low back pain. And what happens is a lot of people give up on their rehabilitation and they then go and talk to a surgeon who might see some pathology or degenerative change on their MRI scan and think that because they've failed every possible rehabilitation attempt, that the only real solution left is surgery. Okay, and then they go and have surgery for their low back pain. And of course, surgery does not remove back pain. Surgery does not remove back pain because surgery, you cannot cut out back pain. Okay. And therefore, that doesn't mean that patients shouldn't have surgery for back pain. I'll explain that in a second. Surgery is a very important element of back pain management. But if you expect surgery to be the solution to your back pain, then you're going to be disappointed. And what happens is then when people are uneducated and when people don't conceptualize the management of back pain correctly, then we say that the surgery failed when they continue to have back pain after surgery. And they call that failed surgery syndrome. Okay. They call that failed surgery syndrome. And now we're approaching a time when the government is starting to step in and say, hey, all these people are having surgery and they're still in pain, and we need to crack down on the surgeries that are being performed for people with back pain. And so the government is now saying no more surgery. Okay, and it's this perpetuation. And it's wrong to draw that conclusion. It's absolutely entirely wrong to draw that conclusion. But unfortunately, our government now, Medicare, is starting to implement changes by the end of 2018 or in November of this year, that there will be changes to the way spinal surgeons can offer treatment because Medicare will say there are much more stringent rules associated with the performance of surgery for people with back pain. And I'm not saying that's a bad thing, but what I'm saying is that it reinforces the misunderstanding that surgery was ever meant to cure back pain in the first place, and it's not. Surgery cannot cut out back pain. That does not mean we should not be able to perform surgery for people with back pain, but the most important thing is that surgery gives someone the potential to then participate in effective rehabilitation, and it's the effective rehabilitation that gets rid of back pain. Okay, so there is a lot of poor rehabilitation in the there's a lot of poor rehabilitation practiced around the world, and therefore we have to accept that failed rehab syndrome exists. Surgery does not remove back pain, but patients who have back pain sometimes need surgery. Surgery gives patients the potential to rehabilitate effectively. Okay, and this is the key word here, effectively. We don't want to just keep flogging a dead horse and just keep doing the poor rehabilitation that we know already failed them. And that's where we step in with our paradigm shift approach in rehabilitation of, and hopefully you can see this, our paradigm shift in rehabilitation, effective rehabilitation, is functional movement therapy. Okay, so the paradigm shift is functional movement therapy. Now, when you implement functional movement therapy, you are now delivering effective rehabilitation because you're actually eliminating the cause of the back pain. You've finally eliminated the cause of the back pain, and the cause of the back pain is movement dysfunction. Okay, everyone who suffers back pain has an element of movement dysfunction in the way that they move and control their spinal movement. That is the cause. Movement dysfunction is the cause, and functional movement therapy is the treatment. Surgery is required sometimes to allow patients the capacity to participate in functional movement therapy. And that is really sad that the government is misunderstanding, and a lot of commentators are misunderstanding the subtleties about back pain management, to the point now where the government is actually changing the system that is in place that allows surgeons to perform spinal surgery that admittedly a lot of them think that their spinal surgery fixes back pain, and that's a misunderstanding from the surgeon's point of view, and it also then conveys to the patient that, you know, the surgery's failed. But even the surgeons need to understand, and I'm trying to get this out into the industry, that surgery doesn't fix back pain. Surgery gives someone the potential to participate in effective rehabilitation that then will cure back pain. And my practice, our centre, operational since 2011, has managed many patients with back pain that have failed every other form of therapy. That we've managed patients who have had surgery elsewhere and continue to suffer pain because of failed rehab syndrome, not because the surgery had any complication. The surgeon very effectively achieved the goals of surgery, but the patient still was disabled afterwards. The reason that the patient failed to recover from their disability and pain is because of the absence of effective rehabilitation. And when you implement effective rehabilitation, the patient is now on the correct roadmap for their journey from being disabled to recovering. The journey can sometimes be a long journey, 6, 12 months, but what we can confidently say to people is that once they are following the correct roadmap, that they will be successful in reaching their goal of being functional, regaining athleticism, eliminating disability and and pain, as long as they continue to stay on that roadmap of movement, of practicing movement proficiency in their everyday activities of living. When you practice movement proficiency in your everyday activities of living, you're essentially rehabilitating 16, 18 hours a day. Every minute that you're not lying in bed, every minute that you're moving, you are rehabilitating, because it's the movement proficiency that eliminates the inflammation and all the other pain mechanisms that exist in our body, in our back, in our muscles, tendons, ligaments, joints, cartilage, discs. All of those elements that are driving up pain are being suppressed when we move our spine proficiently. It's not always obvious to people. It's not always obvious to people what it means to move well, and that is exactly why I have established these centres, which I refer to as Functional Movement Training Centre, and our program Rehab, because it's not widely available and therefore integral to my practice as a spinal surgeon, looking after many, many thousands of people with back pain. I need to have effective rehabilitation as part of my management program. Without the effective rehabilitation, I can't manage the thousands of patients that come to see me, and I have not been able to do that elsewhere in the community, and that's the reason why the Functional Movement Training Centre and Rehab developed in the first place. Okay, so that's all I wanted to say today. It is a bit concerning. Follow the news about the Medicare changes to spinal fusion, and you may be interested to see how that pans out over the next few months, because I, for one, am trying to get Medicare, the government, my colleagues, my other surgical colleagues, my non-surgical colleagues, to understand this very subtle, but it's imperative concepts if you're going to look after back pain. And as spinal surgeons, we see a lot of back pain, and as non-surgeons, there is a lot of back pain out there, and if you're delivering ineffective rehab, you're driving the problem, making the problem worse, and it's now reached epidemic proportions, with back pain being the #1 cause of disability on the planet. All right, on that note, cheerio, and I'll talk to you next time.